Thank you for your patience. And if you get disconnected, please rejoin. Okay. Today's presentation is brought to you by the Finger Lakes Works, whose mission is to improve the economic development and well-being of job seekers and employers in the region by aligning human potential with the opportunities that exist in the workplace. We do that through the provision of job seeker service at one of our 5 career centers located in the 4-county area. And we do it through our business service team. We have business service reps stationed in each of the 4 counties, and the services they can provide include recruitment events, job posting with our partner, the Department of Labor, and then we also have training grants, on-the-job training for new individuals and to upgrade skills of current workers, and then we also have customized training grants. As workers try to navigate through the new requirements that the COVID-19 pandemic has placed on communities, limited childcare options, and changing school closures present a parallel crisis. Working parents and their employers now find themselves in an ever-changing world and care landscape that can be increasingly tricky to navigate. Employers who are urgently addressing the care needs of employees during this emergency, especially those in lower income settings, can achieve business sustainability, productivity, and profitability in the long run. In August, 10 NBC News up in Rochester reported on new studies showing that 15% of parents nationwide are planning to leave their jobs. 72% of parents don't currently have childcare. 14% said they're comfortable in sending their kids to daycare during COVID. 20% said they're more likely to quit their job now than in pre-COVID times. So given that, the backdrop, we've assembled a panel of experts to assist us in kind of navigating through this and letting employers know of the services that are available to both them as an employer, but also to their employees. Our presenters today are Julie Champion. She's the Executive Director of Child and Family Resources. Renee Scholz, Family and Employer Services Director of Child Care Council. And then Kay Jennings. She's the Head Social Welfare Examiner of Ontario County Department of Social Services. So with that, I'm going to give it to Julie Champion. Let me just get her presentation up here. And Julie, I believe I just unmuted you.
Yes, thank you, Mike. Good morning, everyone. I'm glad you were able to join us this morning. I'm hoping to give you as much information as I can to help you understand and navigate where childcare is at right now. I'm the Executive Director for Child and Family Resources, as Mike said, and we serve Ontario, Seneca, and Yates counties. And what I mean by we serve is we are a child care resource and referral agency, as well as a family resource center. We have locations in Geneva, Penn Yan, Seneca Falls, and Canandaigua. Now, our mission is really all about children and families, hence our name. But we really want to support parents, helping them with parenting skills, as well as child care providers, and helping them provide quality care and help children in all of our service area to thrive and develop and have positive learning experiences. So a lot of our services, you may have heard of some or not, we have childcare referrals and information on scholarship programs that will help parents pay for childcare. We also have recruitment and support to create additional family-based childcare programs and center-based childcare programs. We offer parenting education programs, home visiting, parent support groups, teen parent support groups. And we're often finding that parents just need access to resources. So we have several programs that help us provide concrete supports for families, like car seats, diapers, formula, safety gates, porta cribs, and whatnot for families in our service area. So you can always find us at www.cfresources.org, and our website is pretty comprehensive. We're undergoing some changes with it, but if you're curious about some of the services, feel free to check us out there. Mike, could you go to the next slide for me?
I'm trying.
Sometimes if you right click on this with your mouse and then hit next, it'll go.
Thank you.
You're welcome. Well, one of the first things I kind of want to talk about is before COVID-19 hit, childcare was already in a crisis. There was already a lack of infant care and school-age childcare slots for families. So we were already scrambling to find care for these children. One of the other problems is that parents typically cannot afford childcare, with the average cost being anywhere from $8,000 to $12,000 a year, which is typically quite more than annual tuition at colleges. Parents really need support in helping to pay for their childcare. There are some childcare subsidy programs out there. And unfortunately, they are only able to serve about 17% of the low-income families who apply. And that's mainly because funding is limited. And Kay will talk a little bit about that from her perspective a little later. What we also know is that non-traditional hours of care are very difficult to find in regulated childcare programs because of ratio and some of the requirements. And that more often than not, parents tend to use informal or family members to help care for children during the non-traditional hours. And by that, I mean second and third shifts. There are a handful of childcare providers in our service area that do provide that, but it's few and far between. One of the other key pieces about childcare is that the providers are grossly underpaid, and most of them make minimum wage and have very limited benefits. And the issue is that who's going to pay for higher wages for childcare providers? Are the parents going to have to pay a higher fee? They can't afford it. So someone has to help support both the parents and the staff. Whoops, I lost the PowerPoint.
Oh, I'm sorry.
So one of the other pieces, there we go. I think we're on screen 2. One of the other pieces that we've known for many years is that there has to be some sort of support from employers as well as community to help support childcare programs. Can you go back one slide, Mike? Thank you. One of the other things I did want to note, because I know that a lot of our audience today is employers, and I know that as an employer, you need people who can work in your jobs and positions and shifts that you have, but rotating scheduling practices makes it very difficult for families to find childcare. I will say that is one of the barriers, because regulated childcare has strict requirements on the number of children. So if we have a family trying to find childcare and they have care in a regulated program, but their schedule changes from week to week, it's very difficult for them to hold that slot. So more often than not, families are forced to pay for care when their children are not there to hold the slot so that they don't lose that spot. So next slide, please. Okay, during the shutdown in our service area, Ontario, Seneca, and Yates, we had 19 of our 23 centers had to close. And we had 6 of our 75 family childcare programs closed, and 14 out of 16 school-age childcare programs closed. Those who remained open were able to still provide care for essential workers, and it was a very low enrollment due to the unemployment and from folks working from home. So providers who did remain open struggled because they had a lack of revenue due to that low enrollment. And unfortunately, some programs, more of the larger centers had to close because they couldn't keep their door open because they didn't have enough revenue to support the staff. So again, those employees were unemployed at that point. Other programs closed for precautionary reasons, as many did during that time frame. One of the posed risks for open programs is that due to the increased preventive measures for cleaning and sanitizing and all of that, there were smaller group sizes, which again made the low enrollment necessary. So with that, we had a lot of programs that because they had lack of revenue, because there was a scarcity of supplies, as you know, some of the programs couldn't access all the food or cleaning supplies that they needed, which made it difficult for them to stay open. So some of them closed for that reason as well. Luckily, one of the pieces that we were able to help support programs with is the state released some federal CARES funding to support childcare. And we were able to purchase and distribute supplies, cleaning, PPE supplies to all of the open programs so that they can continue to provide safe care for the children that they were caring for. Through that CARES funding, we were also able to help distribute a CARES scholarship program for essential workers. And that program was designed to support essential workers who were still working if their income was at 300% of poverty, which is roughly, I think, $78,900 for a family of 4. That program ended on June 30th, but the good news is that's about to be re-released any day now. So I do want to say that if your business has workers who are deemed essential by the executive order, they could be eligible for this scholarship program. And I would strongly encourage you to share that information with them. On my last slide, I have some of the links for that as well. But you will be asked as an employer to provide a letter that outlines that the person is an essential worker, the hours that they work, and what their income will be. So you might expect that from some of your employees if they are eligible for this program. So lastly, one of the other issues that childcare programs and parents faced was that the schoolwork support that parents needed for their children who were virtually learning was very difficult to achieve in a childcare setting, because many childcare settings, they didn't have the internet capacity, nor did they have the staff capacity to provide schooling support for children while they're also caring for children who are younger ages. So that was a bit of a struggle for the childcare community. Next slide. So moving forward, 95% of our programs were open by the end of July. For the centers, the reopening and maintaining overhead with the low enrollment is still a struggle. We have many programs who were able to access a CARES 2 grant, which helped them with temporary operating costs like rent, utilities, staffing, as well as some emergency supplies and cleaning supplies. But it's a timely process, and there are some centers who are so very behind in their revenues that they are considering closing because they still can't afford at the capacity that they're at to remain open. So that is still a barrier, even though 95% of the programs are open. Some of the revenue issue is impacted by both parents who are not working, who no longer need the care, and the fact that OCFS and the actually CDC have mandated smaller group sizes in childcare setting as they have in many other businesses. So that really affects the slot availability. So families looking for care because they are working are having trouble finding it because of those limitations as well. Again, the whole school delivery affects the delivery of childcare, and that children have to have settings where they can be learning in a childcare program. We've had some very creative solutions. We've had churches that have opened up as virtual learning centers for school-age children that do not have to be registered by, New York State, because they are a single purpose program and it's just for that virtual learning. And I think that's where some of the school-age support is going to have to come from, is those types of programs that can provide that safely for families and children. One of the other barriers we had was that 7 of the 16 school-age programs in our region were actually located in school buildings for their school-age program. And because of the COVID restrictions for social distancing and cleaning, schools are not allowing the majority of them to reopen in the school building. So those programs have had to relocate, and they've had to find another location that meets all the state standards. And they've had to then add the burden of paying a rent fee on top of their already dwindling resources. So that is a struggle. Next slide. Oh, is that a duplicate? Let me go back. There you go. And one more. Okay. Part of the CARES 3 federal funds that New York State is releasing includes rental assistance to the school-age childcare programs, so that if they were if they did have to relocate to a new facility because they're not allowed in schools, this program will help pay the rental fees for the next 4 months to get them through that time frame. And we're hoping that come January that things might change a bit so programs can go back into schools. But as you well know, there's no certainty in that. One of the other barriers I've heard from child care center directors is that because of the unemployment benefits, and I'm sure many of you are familiar with this as well, and because of the low paying wages for childcare staff, unemployment was higher than what they earned. So it was difficult bringing their staff that they had laid off back at their normal rate of pay. So that was a barrier. As far as demand for care, I know that we've heard from many that parents can't find the care. And at the same time, we have families who are choosing to have a non-working friend or family member provide care rather than a regulated program because of cost and availability. And we also have obviously unemployed parents who no longer need the childcare slots. So there's a variety of factors that are impacting the availability of the childcare slots in our area. So, and again, the CARES 3 scholarship, which is due to be released any moment now, will help support essential workers who need assistance with childcare costs. Next slide. This is my last slide, and I wanted to provide some resources for childcare. So if you have parents needing care, they can contact us for Ontario, Seneca, and Yates counties to get referrals to childcare programs that we believe still have openings. And our number is there on the screen, as well as an email to our Teresa Bryan, who is our childcare resource referral specialist. And she can assist families in locating the care. As far as childcare cost assistance, There are local county Department of Social Services have childcare costs, and Kay will talk about that a little bit more, but I do have the links to each of the counties that we cover. I know Renee covers Wayne County, so she'll be able to give you some information on Wayne County resources. And then I did include the last bullet is that link to the childcare scholarships for essential workers so that you can share that with your staff who might need assistance for childcare. So, and that's the end of my presentation.
Thank you, Julie.
You're welcome.
Let's see if we can get another screen share for Renee here. Give me just 1 second. Renee, can you, let's just see. Can you unmute?
I just did. Can you hear me?
Yes, that's it. You sound great.
Great, thank you. Julie and I are both resource and referral organizations. So she covered quite a bit of really what we do. So what I'm going to do is just do a general overview of our services and then talk a little bit more about how we can further assist families. So our main branch office, we serve 3 counties, is in Rochester, but we serve Livingston, Monroe, and Wayne County. And the reason why I include that as well is you perhaps may have folks that are coming to work that may live outside of Wayne County or Seneca County or Yates. We're part of the Resource and Referral Network. I believe there's 32 of us, Julie, around the state, if I'm correct. And I'm the Family and Employer Services Director. My contact information is on this front slide, obviously. So if families do need referrals for childcare or whatnot, they can reach out directly to me, or if you need to reach me. Next slide. So I'm just going to gloss over quickly some of the things that we do. And the reason why I'm doing this as well is perhaps you may have families that might even be interested in knowing like what does quality care look like as well as what the process is. We have a professional development component to what we do. And what we do is we build businesses. So with that, we've got quality enhancement. So we do the CDA, we do in-services, technical assistance, startup grants. We help we help providers that work with children with special needs and families with special needs. We have a component to that as well. Next slide. The big part, what we do here, I'm the Family and Employer Services Director, and we provide referrals to licensed and registered childcare programs. I know that it does, we do serve Wayne County, as I indicated. And some of the challenges that I think parents are facing, particularly in the outlying counties, as Julie indicated, some of it's finding care and building the businesses out there, finding enough programs. The schedules can be challenging as well if families are working evenings. We don't seem to be able to find care for the evenings. So what we do is at least we talk parents through this process and try to help them navigate and problem solve perhaps some other options if that's the situation. We also discuss other resources, and some of that may be childcare subsidies and connecting them with the resources that are available financially. For Wayne County, it would be Wayne County Social Services. Monroe County has some other options available to families. And the other component that we can offer are on-site referrals and education. So if you find that perhaps you have a group of families that really would like us to come in and talk to them about like what we can offer and childcare options and navigating through that process, we're more than able and willing to do that. Next slide. The other component to what we do are the legally exempt services, and Julie had touched on that as well, because what we're finding is, particularly during this pandemic, is many families aren't wanting to perhaps send their children to a licensed program. They have concerns about the safety and well-being. They would rather have a family member or a friend in a smaller group provide the care. So what we do, we assist people in that enrollment process, and that's for families that are receiving subsidy for childcare. So we would do the legally exempt enrollment packet with them. The programs, it says they're inspected. Right now, there's nothing happening with offsite inspections due to COVID for safety reasons. But it's another opportunity and another option for families anyhow. And I'm finding more and more families are going in this direction. Next slide. The other component, we have our registration and inspection services. So they assist families, or pardon me, they assist programs in getting licensed and registered. The school age programs, as Julie indicated as well, really have taken a hit because particularly in Wayne County, they're all housed in the schools. So none of them have been open during this time. For some of the other ones, they've tried to fast track registration for programs offsite outside of the school, but they're not operating at this point within the schools. Particularly like Wayne County Action Program had a lot of the school age programs, and at this point there's some challenges, I think, for families. And as you can see, they oversee, they work collaboratively with OCFS as well and do monitoring visits, again, when that's allowed. Next slide. We have our business administration services. As you can see, we offer scholarships, we do notary services, we also do fingerprinting. So this may be something that you as employers weren't aware of. If you have folks that need that service, we do that in all of our branch offices, including our main office. So I'm just going to skip over that one as well. Do a quick read there. Okay, next slide. Another component that we have is we have a child adult care food program, and that's a quality enhancement for programs that are participating and for families. So they know that their children are getting healthy foods. They participate in that program and they have to adhere to the USDA food guidelines. And at this point, there probably are over 300 programs that are enrolled in that, and we have a connection with the food co-op through FoodLink as well, which was occurring prior to COVID. Again, that's changed a lot of how we do our business. Next slide. The health services and our nurses have been really busy most recently. They do asthma-friendly endorsement. They also do our med training, our healthcare consultant services, and they have been such a resource for our providers and our families during this time as well, as we're navigating through this whole process and helping programs adhere to the CDC guidelines and in being able to ramp up the health and sanitation and the safe practices of what they're already doing, but again, meeting those higher needs. Okay, next slide. We also have a multilingual services team, which as employers, you may have folks that have different backgrounds. So we're very fortunate to have, as you can see, Spanish, Swahili, Somali, and Arabic. Particularly, I'm sure in Wayne County, there may be more Spanish speaking folks, but they can assist through interpretation for training, registration, orientation, also with referrals for childcare. So we do have people in this department that can assist your families and work through that. Okay, next slide. And here's just our branch offices in our main office. It's our address, our phone numbers. I know that was just a real quick general overview of some of the services that we do offer. During this time, I know there's a lot of challenges that families are facing, the providers are facing, as Julie had mentioned as well. We also have the opportunity through the CARES Part 1 and Part 2, and now Part 3 that is coming, to assist with the scholarships for families. I believe we paid out, last I heard, about $500,000 for that. Also in assisting programs with the supplies. It looked like Amazon here as we were really filling orders for programs so they could meet the needs. We had masks, we had gloves, sanitation wipes, those types of things that were available as well. And with the CARES Part 3, there's an opportunity for parents to additionally access some other potential scholarships. And hopefully that money and that process will be released shortly, as Julie had indicated. Thank you.
Thank you, Renee. Great information.
Thanks.
I'm going to ask Kay to unmute if you can. Great. And then I'll see if I can't get her her website here. Kay, can you start just talk a little bit about social services and your role with working with kids while I attempt to find your
That I can.
your website.
I supervise the low-income child care program, which is a program that's administered by the Office of Children and Family Services. It assists low-income families in paying for child care expenses to certified providers, either daycare centers, family and group registered providers, or legally exempt providers that are approved through Child and Family Resources in our county. And basically, the household has to apply for assistance. Our website link that is now up. The application is right on there. So if someone wants to go in, fill it out and email it to us, that works. We get a lot of them that way. Basically, the family has to be employed at least 20 hours per week in order for us to cover their child care expense while they're working. It's income based, and they have a parent fee. So they're responsible for paying a share, and we pay the remainder up to regional market rates. And it assists our clients in being able to go to work. A lot of times right now during COVID, we did receive a CARES grant through Office of Children and Family Services, which allowed us to cover the child care expenses while the daycare centers were closed, or because the child wasn't attending because the parents were not working. We got that grant from March 15th until June 15th, and it allowed us to help the center stay in business. Basically, we can also pay sleep time. So if we have a parent who works the overnight shift, we're able to pay another 8 hours of sleep time during the day hours so that parent can rest. On our website, we have links to the application. If you want to scroll it down just a little, Mike. There are links to the application, both in English and Spanish, and how to complete the application, both in English and Spanish. And then there are the Ontario County income guidelines, which are the same for every county in the state. So it's based on, currently we're opening cases up to 175% of the poverty limit due to lack of funding a few years ago. But we did receive an expansion grant for 2 years that allows us to cover up to 200% of the poverty limit currently. We can also pay while a parent is looking for work for up to 2 months, up to 20 hours a week, so their children are being cared for. And currently, if with the remote learning, our school-aged children, we're able to pay for the days that, full-time days for the days that they are doing remote learning if they have to go to the provider. To a registered provider, we're able to pay those full days of care, and the informal providers as long as they're approved through Child and Family Resource. But each one of the counties has a program. Ours is run through the Department of Social Services through the Temporary Assistance Unit. I believe Yates County is also run through the Temporary Assistance Unit, and Seneca County is run through the workforce development unit. But the clients do need to apply. They need to provide documentation of their hours worked, their income, their child support, who lives in their household. And we base it on, it is a assistance program, so they have to prove their eligibility for the program. But we have around 200 cases, which is kind of low for us, but because some people are unemployed currently, they don't need our assistance currently until they go back to work. Do you have any other questions?
Great, Kay. We're going to look at the chat in a second here. Just so I'm clear, so this is for Ontario County, but I also heard you say that this service is available in all the regional counties.
Correct.
Okay, great.
I know Wayne County currently it's in their services unit, but they're getting ready to move it over to their temporary assistance unit.
Great.
Can I ask a question?
Right, I'm sorry?
Can I ask a question?
Sure.
Thanks. Hi, ladies. Thank you very much. It was awesome. Mike's in the office and I'm at home. So that's why I zoomed in. Kay, for the counties for the reimbursement, if family members are watching children, can they be reimbursed if they're being paid?
They can, but they have to be approved as a legally exempt provider through Child and Family Resource.
Okay.
And currently, everyone has to go through a fingerprinting and background checks now. The only people that are exempt is if it's a relative to a certain extent.
Okay. Thank you.
So we had a couple of questions, but there are more comments. We had one question here, though. Any suggestions / contacts for assistance in Wayne County? Renee, I would imagine you would be a good contact for services in Wayne County, but anybody else? Do you have any contacts in social services, or would you recommend that they follow up with social services?
For the application part of that, because at this point, that's the only funding in Wayne County. So we would connect them with that department.
I didn't catch you in the beginning. You were cut off. Could you start?
I'm sorry. Yeah, we would just refer them to social services. Their income level is at 200% of the poverty level right now. So we would, parents would just make that phone call and start that process.
Great. I am looking at the chat. Will the slideshow information be emailed after the meeting? Yes, we'll send you all the information that was presented, along with a feedback form to provide us with some feedback on today's presentation, and looking for ideas for other presentations that you as employers might find have some value. If you have questions, that's all we have in the chat room. If you have questions and you want to unmute yourself, you're welcome to do that. Any questions? Here's a comment. Amazing amount of information here. Hoping to receive the slideshow via email after the review in the future.
One thing I can add, the application is a state application, so any of the counties can use that application that we have up on our website.
Oh, great.
And it's all done by mail. They don't have anything face-to-face. It's all done by mail.
Great. So you talked about free and child care referrals for employees. On-site presentations, these can be on-site at any employer's area, even with, are you doing this with the COVID now, or are you holding off on that, or are you doing it virtually?
That's a service that we can offer. We haven't had a request yet. And with COVID, it's so interesting because we could do a virtual one. I'm going to be doing a virtual childcare fair in Monroe County with our Swiffy grant. And we'll be doing some breakout sessions with that. So it is an option and an opportunity to convene parents together if that's a need.
Great.
And that would be the same for us as well, Mike. We haven't had any requests to do that most recently because of COVID, but we are willing to work with an employer if they would like us to either come in virtually or in person.
Super. Outstanding. Any other questions?
Can I just say something about our referral service?
Sure.
That I don't know if I'd indicated the different ways, like parents can contact us directly via telephone. Typically, if they call our Wayne County office, they would refer them to us because that's our branch office. So all the referrals do come out of our main office. It doesn't mean we don't serve them. But some families find it easier to just get on the website as well. So they can, especially if they have different hours, they can't call between 9 to 5 or their work, they just don't get the time to do that. So they can access our website, and that was on the last page as well. They can either perform their own search and do it create an online profile for themselves, which we do review and make sure that parents do receive referrals, or they can do an email request form and send that over. And then one of the family specialists certainly will enter their information and perform the child care search for them.
And that
Great.
process is the same in our agency as well.
Excellent. I'm sharing a screen now. Just a couple other things. As I talked about earlier, today's presentation was brought to you by Finger Lakes Works and the Finger Lakes Workforce Investment Board. We have business services available. If there's businesses looking for help with recruitment, job posting, on-the-job training grants, or customized training grants, below you can see the list of the business service reps in Ontario County. There's Mike Sykes. Seneca County, John Vrabel. Wayne County, John Celso. And Yates County, Lisa Principio. They're there to help you navigate through the system. And if there's ideas that you have for other presentations, either virtually or in person, please let us know. Our website is fingerlakesworks.com, and I'll be sending out a feedback form shortly for your feedback. And I want to thank our presenters, our panel of experts, great information. And I want to thank everybody for Zooming in today for today's workforce webcast. Have a great day and a great weekend. Thanks.
Too.
Thank you.
Thank you.